What is the difference between influenza and COVID-19? Influenza and the coronavirus disease COVID-19 appear to be very similar. After all, both are respiratory diseases, and they are transmitted via contact with infectious respiratory droplets. Beyond that, however, they differ in important ways. What are some of these differences, and why do they matter? Contagiousness. One difference between COVID-19 and influenza is that the former appears to be more contagious than seasonal influenza. A person infected with influenza spreads the disease to another 1.3 individuals. For COVID-19, an infected person spreads illness to another 2 to 2.5 persons. Severity of illness and death rate. COVID-19 also appears to cause more severe illness more frequently than seasonal influenza. Part of this difference may be attributed to the fact that COVID-19 is caused by a new type of coronavirus, against which humans have no immunity. By contrast, many people have at least some degree of immunity against seasonal influenza, enough to prevent hospitalization and complications in most instances. Along those same lines, COVID-19 is deadlier than influenza. The mortality rate of influenza is roughly 0.1%. Meanwhile, the case fatality rate for COVID-19 is estimated to be about 1.4 to 4.5%, with risk of death being significantly higher for older persons than for younger individuals. Seasonal nature. Seasonal influenza, as its name suggests, tends to come and go as the weather changes. Influenza viruses circulate year-round, but the number of new influenza cases generally increases in the cooler months and tapers off in the warmer months of the year. This does not mean that cold weather causes the flu, rather, cool weather, by bringing people indoors, along with other changes, is a contributing factor. It is possible that COVID-19 could turn out to be a seasonal illness, similar to influenza. However, experts warn that, at least for now, amid the ongoing pandemic, warmer weather is unlikely to drive the disease away. COVID-19 is a new disease, and there are many millions of people worldwide who have not yet been exposed. This deep reserve of potential hosts could fuel sustained transmission through summer in the northern hemisphere and winter in the southern hemisphere. Many factors, however, determine seasonality of diseases, and more time is needed before conclusions can be drawn about whether COVID-19 is a seasonal illness. Causative agent. A more obvious difference between influenza and COVID-19 is in their causative agents. Influenza viruses belong to a virus family known as orthomyxoviridae. COVID-19 is caused by a coronavirus named SARS-CoV-2, which is classified in the family Coronaviridae. Both families consist of RNA viruses, but they differ particularly with regard to the protein layer that encapsulates the RNA. More specifically, influenza viruses express two surface antigens, foreign proteins, hemagglutinin H and neuraminidase N, which trigger an immune response. The exact form of these antigens changes every now and then, resulting in the periodic emergence of new, more virulent influenza viruses with the potential to cause a pandemic. The surface of SARS-CoV-2 does not have these antigens. Rather, similar to other types of coronaviruses, its outer surface is studded with glycoprotein spikes, which give such viruses a crown-like, or coronal, appearance. Spike glycoproteins are responsible for triggering the immune response, and they carry out the critical function of enabling the coronavirus particle to enter cells, where it then replicates.